Trust in science is low. I think the last poll that I saw had it at -5%. There are large groups of people who believe that the Earth was created in the last 10,000 years, that humans and dinosaurs coexisted, that the greenhouse gas emissions we're pouring into the atmosphere are just fine because the climate has changed in the past, and that we may have 10 times as many guns as another country, but the problem is actually that we don't have enough guns. But when it comes to gluten, better safe than sorry. And in terms of vaccines, there are a lot of well-meaning, well-intentioned, intelligent parents who are just simply more likely to believe some guy on Reddit named Gene, who has some incoherent ramblings and apparently once lost a contact lens into his brain, than they are all of the doctors and scientists combined. So why is that? Part of it is that Gene is anti-establishment. He's radical, he's novel, and he's not afraid to tell it like it is. Whereas we doctors and scientists are necessarily of the establishment. And we're also not good, generally, at thinking of ways to communicate that are novel and engaging and new. So 5 years ago, I stopped my radiology residency and became a journalist full-time, and I've become kind of obsessed with public discourse on public health, and I think there's a lot of ground for us to gain in being better communicators as scientists and doctors. And I think the key point is that we tend to think that in order to be novel, we need to be sensationalistic, and that we can't communicate simply without communicating simplistically. So if you've ever been on the internet, you know that some things are popular and some things aren't. And the popular things have something in common. And it's not that they're high quality or accurate or important. It's that they're novel. So to take the example of Moby Dick, you've probably heard of it. It's a book that's widely, highly regarded, and a lot of people have not read it, and it's available in full text on the internet for free. You could be reading it right now. It's probably would bring more value to most people's lives than whatever we read this morning. And yet, how many of you had a friend who shared it on Facebook this morning? Probably not more than one or two of you. Because it's really good and it's really well done, and most of us would benefit from reading it, but it's not novel. And focusing on that novelty is something that we humans inherently do. There's a phenomenon called neophilia, which supposedly has some evolutionary benefits. It's good for us to want to try new things, but we've also taken it to a degree where some people become obsessed with novelty. And instead of learning about the history of the Civil War, we just constantly refresh our Twitter feeds to see what our people in power have said. So neophilia makes communicating science especially difficult. And a great example is nutrition. Publishers of stories for the public tend to want something that upends conventional wisdom, that shifts the narrative, that takes everything you thought and proves it wrong. Makes you think about something completely differently. But the problem in science is that's just not how things work. What the public hears is one day eggs are good, one day they're bad. One day butter is to be totally avoided, and the next day it's back. And I think the New York Times might even be contractually obligated to tell us every few months that breakfast is either indeed the most important meal of the day or causing death. Nutrition science is very difficult, and it takes decades for us to see patterns emerging, and eventually we do find truths. But when the public hears that the conventional wisdom is just constantly being upended, and day after day they're being throttled back and forth, it leads to an overall sense that there just is no truth. Everyone disagrees, and we don't really know anything, so I might as well go ahead and believe Gene from Reddit. What can we as doctors and scientists, and technically everyone is in some way a part of the media now, in that we all share things and we choose to share them in certain ways with certain editorialization on top of it. So how can we be better about that? And how can we communicate simply without being simplistic? There are a couple ways, I think, and one of them is to not worry so much about being smart all the time. So when doctors write for the public, we tend to think that we are writing for children or fools. And avoiding jargon doesn't mean that you're writing for someone who's not intelligent. So if there is an op-ed that's suggesting that people should not feed their kids Pop-Tarts, and then people continue to feed their kids Pop-Tarts, it's common for a doctor to come back and say, how do I dumb it down? Do I need to slow down my language? Am I being too complicated? When actually it might be that we're not asking the right questions. We're not looking at why. People probably know that they shouldn't be feeding their kids Pop-Tarts, but they keep doing it. Because we feel the need to explain. Could be called Dr. Splaining. We've all been patients, and probably all had some situation where a doctor says to you something like, so diabetes is a disease where you're not supposed to drink a lot of Mountain Dew, and it doesn't bother to assess how that you might know that already. We're taught to know, and we do it to our colleagues too. We'll say something like, there was an article in the New England Journal, I don't know if you saw it, but it did this, this, and this, and this, and then go on to explain it in great detail. Instead of saying, there was an article in the New England Journal, did you see it? It's very simple. But we're taught to know. We are taught that from the moment that we get into medical school, and even before, we're studying for pre-med exams, then we're studying for the MCAT, and then we're studying through medical school and residency and fellowship, and we always need to be the person who knows. There's even a practice in clinics, in hospitals, where it's called pimping, and doctors will go around during rounds and ask questions of the younger doctors and students, and you are terrified of missing a question. The ultimate sin is to not know, because then you maybe don't get the residency and the fellowship and the job that you want, and maybe you just look stupid. That carries over into our public communication then. We feel that we always need to know, and we don't spend enough time inhabiting the space where we don't know and following the questions and asking other questions and seeing where that leads us and being humble. And then the ultimate effect is that we come off as elitist and condescending. So to the problem of novelty. There's this thing called the news cycle, which is completely made up, but which needs to have news stories and information constantly filling it. And if we doctors and scientists are going to be part of it, how do we satisfy this need for novelty when that's just not how science works? Things are slowly moving in a particular direction toward truth, but conventional wisdom is not being upended every day. I think we need to challenge ourselves to see new lenses and new angles and new ways of talking about these same age-old truths. So to take a couple examples of what I've done in thinking about that is take the flu. It happens every year, and people know that it kills 500,000 people a year, and that there's a risk for a global pandemic, and that it's prevented by very simple means of staying home from work when you're sick and washing your hands. And yet, people do not want to read a story about that, and a lot of people will still get sick and die from the flu. So how do we engage people around that? What I did was have a public health campaign of sorts around fist bumps. I called it the Fist Bump Manifesto, said that we need to professionally adopt the fist bump and just make it socially acceptable instead of shaking hands. So now that was completely successful, and no one shakes hands. It wasn't, but at least people got talking about, thinking about the flu, maybe getting a flu shot, and it wasn't just me lecturing, and it wasn't just the same old advice. For climate change, again, it's a problem that's almost too big, seemingly, to interest people. It's so large we don't know what to do. So, tack that I've taken is to focus on single choices that we make every day. Specifically around diet, that's a big one. The agriculture system contributes a lot to climate change. And so one thing that people can do, there was a study that found that if all Americans switched from eating beef to eating beans, just made that one change, you don't have to become vegan, you don't have to completely overhaul your life, but just that one change could get us almost halfway to meeting the 2020 climate goals that President Obama established. When it feels like things are overwhelming and we don't even know what to do at a policy level and we're powerless, you can focus on a small change like that that's novel and gets people to think at least about their own dietary patterns and the role that plays in climate change. And a final one that a lot of people seem to be dealing with right now is addiction or habitual checking of the phone and spending a lot of time on the phone. And it's so easy to want to lecture people about that and say just disconnect and spend more time face to face, and that is how we restore public discourse that is healthy. But it's hard to actually do that. So one simple trick or solution that I proposed, it was called grayscaling, where you can actually go into the phone's settings and turn the colors off, which sounds totally joyless. And it sort of is. Except that the brain is programmed to be attracted to all these colors, that all the red alerts, all the bright colors in the apps are meant to keep us coming back, to keep us checking, to keep us feeling pleasure even when we're looking at something that is not inherently pleasurable at all. So there's a way to break that cycle a little bit by turning it gray and making your habits more intentional so that you check that phone when you mean to check the phone. And these are just examples of ways that we can tell novel stories, share novel ideas that aren't necessarily telling people that science doesn't agree and that the conventional wisdom is constantly being upended. The comedian Del Close once said that if you treat your audience like geniuses and poets, that's what they'll become. And I try to keep that in mind, and I think a lot of doctors and scientists could do well to do the same, because the conversation is going to go on whether we're part of it or not. And if we can communicate, if we can reach people, we can restore trust, and we can save the world. Thank you.